You're listening to the True North Success Podcast. Real stories of personal, professional, and financial wins from Alberta's best. With your hosts, Gary Mah and Amy Kim.
Hey everybody, welcome to the show. Today my special guest is Dr. Daniel B. Chambers. He's a medical doctor focused on dermatology and is a Mohs micrographic surgeon in the Edmonton area. Current interests are dermatologic oncology, surgery, and facial reconstruction. It is my pleasure to have Dr. Daniel B. Chambers on the show today. Welcome to the show.
Thank you very much for having me.
So, Dr. Chambers, I gave a quick overview of your success, but can you fill in the details of what you do, who you serve, and how long you've been doing this for?
Yeah, absolutely. So I am a dermatologist and a fellowship-trained Mohs micrographic surgeon. I've been working in the Edmonton area for about 9 months now, but I trained here with medical school and residency, and I did my fellowship in Toronto, which is an additional year of training, which I finished last spring. So I serve the Edmonton community in particular, but anyone in Alberta essentially that is in need of a dermatologist, and particularly a Mohs surgeon. A Mohs surgeon is somebody who removes skin cancers from most commonly people's faces. It is a very precise technique for removing said cancers where they're removed in the office. I check the margins in my lab, in my office, so the patient only has to wait about an hour. Mm-hmm. And then I can see exactly where, if there's still skin cancer left behind, and I go and I take only where I need to take more tissue from. And I repeat that process until all of the cancer is gone, and then I stitch them up or reconstruct them and make them try to look as normal as possible after a large cancer removal. So skin cancers and dermatologic surgery is my focus, but I also provide general dermatology for all age groups, as well as cosmetic dermatology for those interested.
Right. With the Mohs micrographic surgery, so is that with a scalpel, or is that through lasers, or what? Maybe describe that a little bit more.
Yeah, for sure. So it's with a scalpel. So a patient will come in to see me after they've had a biopsy that shows a skin cancer of some kind. Most commonly, it is a basal cell carcinoma or a squamous cell carcinoma. And I draw out, usually around the biopsy site, the scar left behind. And that's where I put some freezing in, like local freezing you get at the dentist, and I cut with a scalpel just around that area, and I walk it down the hall. The tissue is processed and stained, so I can look at all of the periphery and the underside to make sure that nothing is left behind.
Okay. So are these procedures typically done in your office or in the hospital?
They're done in the office. We do them all here. At Symmetry Dermatology here, we have a non-hospital surgical facility, which allows us to perform more invasive surgical procedures outside of a hospital.
Right. And what kind of got you into the Mohs micrographic surgery area?
It's a great question. I get that a lot from my patients. So I had no idea what Mohs was prior to starting my residency in dermatology at the U of A here. But I started to work with a couple of community Mohs surgeons who became mentors of mine, Dr. Chris Keeling and Dr. Muba Taher, who introduced me to what Mohs was, and I worked with them quite a bit over residency, and they gave me a lot of good exposure, and I developed a passion for it. So I was lucky enough to get a fellowship position in Toronto. There's only 2 programs in Canada that offer Mohs training. It's Toronto and Vancouver. And I trained in Toronto with my mentors, Dr. Christian Murray, Noel Solish, and Anwen Chan, which was a phenomenal year. So it was a surprise to me that this specialty was out there, but I couldn't be happier being able to do this every day.
So what exactly is Mohs versus non-Mohs?
Yeah, that's a good question. So Mohs is has the highest cure rate for skin cancers such as basal cell and squamous cell. So if you were to go to a dermatologist or a surgeon for a skin cancer removal, let's say it's a basal cell, they have to take about 4 millimeters around the tumor as a safety margin to ensure that it's all gone. Whereas with Mohs micrographic surgery, I take about 1 millimeter beyond the tumor and I process it in my lab immediately. And I can see if there's any tumor left and go back and take it and repeat that process until it's gone. Unfortunately, with the regular excision, with the 4 millimeter margins, they take it out, they sew you up, they send you home, and it takes about 2-3 weeks for the results to come back from the main lab. And then, you kind of hope that you get it. And most of the time that they do, but sometimes they don't. And then they have to have more surgery, and quite often that gets you qualified for Mohs surgery if you've had it taken out but the margins were positive. They send to myself, and I'll make sure that it's all gone for sure.
Okay, so you can determine quite quickly through the actual removal and then checking, and then through that whole process, it seems a lot more streamlined.
Exactly. I tell my patients it's, a couple hours of waiting in the office, as opposed to 2 weeks of waiting and wondering if it was done. So it's a bit of a long morning, but by the end of the day when you go home that all of the cancer is gone for sure.
Right. Wow. So that must be fairly leading edge type technology, or
it is. It is very specialized. There's only about 20 Mohs surgeons in the country, spread across the country. And it was developed actually initially like back in the 30s by Fred Mohs in the States. But it's been kind of slowly evolving and adapting, and it's much more common in the US to have a Mohs surgeon around. I'd say in the last 20-25 years, Canada has started to have more Mohs surgeons. We're very lucky in Alberta. We have a lot of Mohs surgeons for how many people we have in the province. So it is leading edge, and Canada is slowly catching up with how effective it is.
Right. What kind of sets you apart from the competition? Like what comes easy to you that others might find challenging?
Well, for myself as a Mohs surgeon, I find the reconstruction part very rewarding and enjoyable. Trying to make a cancer removal almost invisible is my main goal, and I found I've been pretty successful at that. So and we provide just really comprehensive sort of like family style care here at Symmetry, where the patients most often leave feeling like it was a good experience, and they are fully informed as to what's happening. So and we keep a close eye on everybody that we see here. I don't just cut out and say see you later. I say I want to see you again in 3 months, and we'll make sure everything's okay. Like I have a long continuity of care here at Symmetry.
So you want to make sure that they're initially treated and they're looked after with continuing care until things are very settled down.
That's correct. Yeah, exactly.
Right. What tips or suggestions would you give someone who wants to be more successful?
I think for me, because it wasn't a straightforward road to going into medicine and dermatology, is find something you're passionate about and always work hard at it. Even on the days where you don't feel like doing anything, just do a little bit and try and push yourself as much as you can. There are days where you're not going to feel like doing anything, but even if you do just a small amount, you can reassure yourself that you did something that day, and then take the rest of the day to relax. So it's a long road to whatever you want to do. Just make sure that you enjoy doing it once you get there.
Right. So what kind of got you into dermatology and even becoming a doctor type of thing?
Yeah, good question. When I started university, undergraduate degree, I wasn't exactly sure what I was going to do. Everybody in the science program said they were going into medicine. So, oh, okay, that's surprising. So I kind of kept my eyes open a little bit. And I eventually decided, oh, maybe I'll go into graduate training and become a professor. So I started a master's degree under Dr. Francois Balduc. I studied neuroscience and really enjoyed it, but I realized that the academic world wasn't quite going to be for me. But Dr. Balduc was, he's a pediatric neurologist on top of a basic scientist. So I worked with him in his medical clinic as a pediatric neurologist and got some exposure there. And it kind of pointed me towards, okay, maybe this is what I want to do. So once I got into medicine, again, I was kind of, I don't know where I'm going to go with this. There's so many different options. There's surgery, family medicine, psychiatry, dermatology. So a whole ton. I just tried to get exposure to as much as I could. And I was lucky enough that early on I got some good exposure with dermatology, and I was fortunate enough to get a position at the U of A as a resident. Dermatology is a very competitive program. It's usually dermatology and plastic surgery are kind of the two most competitive residency match programs. So I was lucky to get that, and just sort of fell in love with dermatology more and more as I trained, and I'm just very lucky to be doing it now.
Right. So it's something that you really enjoy and you really like growing in that area.
Yeah. I think the moment that we think we know everything about something is the moment that you don't. So if you continue to learn every day, I find work a lot more fun if I'm learning something from. I try to think of a learning point from every patient that I see, and it's helping me grow as a dermatologist and just as a physician in general.
Yeah. What's one of the biggest challenges that you've had to overcome in your career, and how were you able to turn that into a positive?
Yeah. One of the biggest challenges was the mental block of, people telling me, well, dermatology is really competitive. Like, are you sure you want to do that? Because if you don't match in a residency spot, sometimes you have to go into a program you weren't planning on, and you may not be as happy. So trying to overcome that anxiety of, well, what if I don't match? What am I going to do? And I have a mindset if I don't try, then I'll always wonder what if. So I wanted to make my attempt, and luckily enough, I matched into it. But it showed me that if you put in the work, you will be rewarded. And I think I've used that all throughout residency. There's times in residency where things are very busy, very difficult. And I just had the mindset of, if you continue to put the work in, it will pay off. And, it has so far, where I was then able to pass the Royal College exam in both Canada and the United States, and then get a Mohs fellowship as well. It taught me that, it reinforced that work ethic is something that can really, really make or break you.
Right. So sounds like setting your goals and then working towards it, and like not give up type of thing.
Yeah, and trying to tune out the noise of people saying like, well, maybe you shouldn't, or if you're passionate about something, you gotta try. And if it doesn't work out, then you can at least say you tried and you learn from that experience. But tuning out the naysayers and just going for it is, I think, one of the most important things that we can learn.
Right. It sounds like things are going really well for you and your business. Healthcare professionals and doctors make very good incomes when they're actively working. The challenge is that when they're not treating patients or actively working, there's no income coming in. So with that challenge, especially looking towards the future, where you don't want to have to be working so hard for that income. So some of them look at different ways of creating income and passive or profits. Things like investing in stocks, bonds, crypto, or using a financial planner. What are your thoughts about that at ways of creating income outside of your work?
Yeah, that's a very good point on, if you're not working, there's not much coming in. So creating that sort of safety net as a physician is very important. I think it's, for me, I don't have a lot of financial literacy. It wasn't really talked about when I was growing up. So for me, it's been really important to meet with financial planners. I have an amazing accountant who helps me, understand and learn about all these different aspects that need to be taken into account. So I think it's crucial that if you don't have the knowledge, to get it from somebody and learn as you go. For me, I've always been interested in real estate, so I'm looking at maybe down the line real estate being a potential investment opportunity. But as this early on in my career, I'm still trying to figure that out. But I think I've learned a lot in the last 6 months alone of where to go with certain things, and I can't thank my financial planner and accountant enough for their advice. And it's an ever evolving thing. Initially we were thinking about one direction, and things changed a little bit. So we're making a little bit of a move. And I think being flexible and not worrying about the tiny little things and thinking more big picture is very important.
Right. So having somebody like a financial planner or an accountant that or where you can lean on, give you guidance and help is helpful.
Absolutely. I have patients come to see me because I know a lot about skin diseases, and I want to go talk to somebody who knows a lot more about investments and financial planning than I do. I think that's the best way to go.
Right. As we're wrapping up our interview, what kind of exciting plans do you have in the works in the next 6 to 12 months?
Well, I'm going to be expanding my dermatology practice here. I'm going to be doing more cosmetic work and cosmetic surgeries, but also just looking at starting up a proper investment portfolio and getting things going from that aspect. So eventually I can retire, hopefully. It's a very exciting time as a physician and for myself personally. So a lot of personal and professional growth.
Right on. Dr. Chambers, that wraps it up today. Thank you so much and sharing your thoughts and insights and tips with us. It was a real pleasure to have you on the show, Dr. Chambers. If people want to connect with you, what should they do?
They can reach out over LinkedIn. I'm fairly active on there. They can look me up on there, and they can always find the contact information for my office at symmetrydermatology.ca. We're in Edmonton in the Windermere area. I'm always happy to chat with anybody.
Right on. Thank you so much.
Thank you for having me.
Okay. Bye-bye.
Bye.
Want to share your success story? Apply to be a guest at truenorthsuccessshow.com/guest. We'd love to hear from you.